Hello, welcome to my video channel, YouTube channel here. I just wanna, let you know how my process is going here. I had a surgery. They did the plug on my fistula, so I've been suffering for over a year, maybe a year and 3 months already. Yeah, it's like a year and 3 months. So right now it's going okay. It's going good. I have 3 weeks and 1 day with today. 3 weeks and 1 day. Today is, my 22nd day that I had the surgery. And it's been okay. He's going okay. He's doing a lot better. I hope it keeps going that way and doesn't complicate or anything. So right now, when you have a fistula plug surgery, they did a big cut. It's big, it's deep, and it's kind of a large cut. I think it's kind of like almost like the pinky, the pinky, a little bit shorter maybe. Yeah, maybe a little bit shorter than the pinky. That's how large the cut is. It's from the hole going towards the butt cheek, going to the outside of the butt cheek, and the dip is pretty deep. So that's why it's taking a long time to recover, I guess, or healing. Um, so when you get a surgery and they leave the wound open, they leave it open, so you have to put gauze on it, and it bleeds, and it drains, a lot of different liquid. It's been draining like pinkish thick liquid, and a little bit of blood sometimes too, but more and more that pinkish, pinkish color. So you have to read a lot about wound care. The most important thing here, wound care, is if it's close to your anus, close to where you do the bowel movements, that has a lot of bacteria. You have to be very careful. You gotta make sure that you clean it really good. Don't leave any of it. Don't leave it nowhere. You have to clean it really good. So it's good to use, the baby wipes. Don't use toilet paper. Baby wipes is perfect for that. And then you have to like spray it with water. If you have those shower head detachments or whatever attachment to the shower, those are the perfect things right there. If you don't have that, you're gonna have to get it. If you ever get a wound or abscess or fistula wound on your butt, you have to get it. And then you have to use like maybe your camera flashlight to, you gotta see it. You always gotta see the wound, because cleaning it or whatever, you have to see it. If you don't see it, you can damage yourself even more, or it's gonna be more pain than what you have now. Oh, it's bad. So that's one of the most important things. And I haven't done any sits bath with this one. I just have a bowel movement. Then I go to I clean it really good, baby wipes, really good. But now I can clean it a lot better because the pain is less. It's a lot less than the first and the second week. The third week is better to clean it because the pain is a lot less. Then after that, I just go straight to the bathtub with the shower head, and you spray it with a lot of water, on the back, down there. You gotta spray your legs a little bit, and take a shower, and then do it again with the shower head. And the only issue that I'm going through right now is when I have to go do a bowel movement. I feel like I have severe constipation right now, that I never in my life had experienced such pain when I go to the bathroom and do a bowel movement. Never. So it's been really bad with that. The couple days. This past week yesterday. I'm talking. Matter of fact, yesterday I had a really messed up constipation, bowel movement. It gets really hard that it doesn't want to come out, and then my whole body starts doing pressure, pushing it out, because once you're trying to do right, then when it gets in the middle and it gets stuck, he doesn't want to come out or anything. Then the body starts doing itself, doing pressure. I could feel pressure by my belly, my back. Everything is crazy. Then when I do that, all the pressure goes to the butt right there, by the wound. When the wound is located, I feel the pressure. Then it starts bleeding a little bit. It starts bleeding because maybe the pressure messes it up or something. It just messed up. So I had 2 times, no, I think the 3 times, bad bowel movements, constipation, and it bled, blood. So it bled like 3 times already. This last time it didn't bleed a lot. It was just draining a little bit of pinkish, but it was hurting a little bit. When I was walking the rest of the day, it was a little bit uncomfortable, and today I feel it. I still feel it, like something happens, with that pressure. So I went to Walmart yesterday and bought some new pills for a stool softener. So I'm gonna use different ones because the ones that I've been using, they don't work. They're not doing anything for me. And I have to you have to remember this, that when you have this wound on the butt, I think I have to eat maybe fish, a lot of fish, a lot of boiled vegetables and fruits, and not anything like maybe don't eat meat, because I ate chicken, I ate red meat, and from that time, red meat and the chicken is when I experienced this constipation. So I gotta stop that. So right now, and yesterday I ate some turkey. So I think might be the meat, or maybe it's because I'm not moving enough, like not doing exercise. But I'm having a bad constipation issue problem right now, and when that right there, it's delaying my wound to heal, I guess, because it starts bleeding a bit, but it's not. I don't think it's the fistula or anything, because I have a plug, and it feels different than before. It feels a lot different. It is a lot less pain too, a lot less pain than before. So and the pain is just when I'm doing the bathroom, and then it's better. But yesterday, I can feel that a little bit of pain while walking. So I felt it like, you know, almost the entire day, but it wasn't that bad. So yeah, that's what I'm going through, and the first week is really painful. You can't even do anything. Everything hurts on the first week of the surgery. On the second week, it's still almost the same pain, even worse. The second week, and those 2 weeks when you go to the bathroom, when you see the what is it? Well, the shit, right? When you see it going out, you can see blood all over it, like at the tip, like at the beginning, you can see blood on it, and then while it was going out, the blood starts disappearing, and it goes with your it goes down with your shit, it goes down, and so sometimes you can see that, but the last time I didn't see that because it didn't bleed. It didn't bleed a lot. Yesterday, it's just a little bit painful after it during the day, the course of the day. Let me see. the third week, you can, I was a lot less scared to go into the bathroom compared to the first and second week. Now I'm a lot scared of going to the bathroom because I can clean myself better. It hurts a lot less, and I can take showers with no issues. You just gotta be very careful when you're cleaning around the wound, because you can't. You have to clean it around the wound there, because in the center of the wound is red. Blood, like the pinkish thing. It's not, the regular normal blood. It's just the pinkish, thick. Okay, so I just want to let you know what I'm going through, and I hope that I can heal from this, because this has been so painful that I really, yeah, it's been really nuts. So you have to read all about this. All of this. You have to go to the internet and see how to care for a wound, because what you don't want to get is an infection. If you get an infection, that's not good. So that's what I'm trying the best, to be super clean and not get an infection. If I get, if I'm bleeding, if it's, and if